my fingers crossed that forecast is going to be just what it says it's going to be for the next few days, because we are so due. And I'll tell you, there's a reason why. Because 'tis the season for getting out, parties, family visits. We want to get outside, picnics. And you know what? If you don't feel that the face you present the world truly represents who you are, well, why not check out the non-invasive therapies available to you at the Aesthetic Associate Centers? Dr. Sam Shatkin Jr. is back with Great Look Monday, and he's got a host of in-office procedures that require little or no downtime that can truly give you the face that you would like to present to the public. So good morning. It's nice to have you here. And we've been talking, while this whole commercial was on, we've been talking about finding your bliss in life, feeling better, looking in the mirror, liking what you see, look back. And a lot of it is being proactive about your health, the things you take into your body, and taking advantage of what now modern medicine has to offer you, even in the way of a good moisturizer. You've brought some terrific products that you have at your office, you've developed, and we want you to really start thinking about this, and you're never too young to start passing down good secrets about moisturizer to the next generation, right? I mean, you've got to use this stuff.
Well, you know, Mae West said you're never too old to look young.
That's right, baby.
But you know what's interesting? We should call this Great Look Monday, Tuesday, Wednesday, Thursday, Friday. You know, every day of the week should be a day that you put effort into making yourself feel better and look better. And it's about this bliss, this inner feeling of confidence, if you would. And there's some things that we have control over. There's things that we don't have control over. We certainly couldn't pick our parents, but we certainly can pick what we do with ourselves every day, what we eat, how we treat our skin. You know, I mentioned to Linda earlier, you know, about, we were taught as little kids to brush our teeth twice a day, 3 times a day. But we should have been also putting creams on our skin, protecting ourselves from the sun and all these things, that we'd look younger throughout our life. And that way, because our skin is like an organ like the teeth, and you got to take care of them.
Exactly. Our skin is a true... It's really a reflection of how we've lived, if you think about it. But there's always things you can still do, and there's lots of great stuff out there that's medically good for you. Like you were saying, there's so many things in your moisturizer now that we know about that's natural and good for you.
The sunscreens now have vitamins in it. We have antioxidants. Our sunscreen that we have at our office, which is our private label product, has green tea in it, which is a great you know, way to keep the sun's ray at bay, and any sun that does get through there will protect your skin and reverse the aging changes. It's all about trying to turn the clock back. You know, as plastic surgeons, we're not going to stop the hands of time. We're going to try to turn the clock back, make you look a little healthier, a little fresher, and ultimately you'll like what you see in the mirror, and there's that inner bliss that you're going to have.
That's right, because if you're feeling good on the outside, but when you look in the mirror, you're not happy with what looks back, that's where they can help. That's where they can help you. At least present to the world the face of the person, the spirit from the inside. And you can do that through so many different ways. First of all, you can do it with lasers. You can do it with fillers, Botox. And if you have a question, give us a call, 644-9840. Dr. Shatkin is here. He can answer your question. Skin peels, facials, less invasive surgery. It's all there for you, and you'd be surprised the results. In fact, take a look at some of the before and after pictures that you brought with some of the ways that you can enjoy these products and feel and look better about yourself.
These pictures are interesting because these are non-surgical methods to rejuvenate the appearance. And you can see, if we just start with that picture at the top, that girl has a lot of wrinkled skin on her neck. Using some weekly treatments can get that result. The middle set of pictures, the before and after, demonstrates how the brown spots can be improved and the coloration. And the bottom one shows severe sun damage. Now, this is not going to happen overnight. This is several weeks to months of treatments, but this is non-surgical methods. We have the equipment in the office. We can advise them how to do a lot of it at home on a daily basis, and the results are very consistent, and you can really make a dramatic improvement. And now's the time to make that proactive choice and making yourself look better. And that's how we feel better too.
Yeah, don't say to yourself, you know what, in 5 years I'm going to go and see him about this. No, the time to be proactive is now. So in 5 years, you're still pretty much liking the way you look.
I think the skin can stay healthier longer. Here's a good example
of a
pre and post Botox treatment. You know, we've shown these pictures before. Using the Botox, the smile lines can be diminished and softened and relaxed. The Botox literally takes about 5 minutes to do. Patients are in and out of the office. The first time, we'll spend a little bit more time discussing the procedure, but generally in and out doesn't take long at all.
And it can last for months.
It does last for several months, a minimum of 3 months, but usually we get 4 or 5 months out of that.
All right, we have somebody on the phone, and so we're going to go to our phones this morning. Perhaps there's a question out there that Dr. Shatkin can answer. Hello?
Hello?
Good morning, Linda.
Yes, good morning.
Hi, Dr. Shatkin.
Good morning.
This is Erin from North Buffalo.
Okay.
And I suffered from a cleft lip and palate as a child. And I was wondering, because of the deep ridging and scarring on my upper lip and the thin upper lip due to the cleft lip and palate, is there anything that I could use for that?
Right. Well, if you have some scars that have that are still elevated or thickened or widened, they can be surgically revised, which is a very simple procedure. On the other hand, for those individuals that have scars, like you might have, or even acne scars, things like that, there are some treatments that we offer. There's some non-invasive laser treatments that can really diminish those scars, and these technologies have really advanced a lot in the last couple of years, and we have those machines at our office. And, but generally, good skincare also will help. So most of what we recommend, even if I'm doing a full facelift, I'm also recommending the topical treatments, the things you can do at home on a daily basis to make a difference. And I think that really will give you the best end result.
So she should come on in.
She should come in, yeah, sure.
For that consultation.
You know, the best way is let a doctor take a look at you.
Yes.
Let them see what's going on and try to figure it out. And if she's had some cleft lip and palate surgery, she probably is a plastic surgeon. Go back and talk to your doctor and they can help you, or you can come to see us.
Absolutely. And that's what Dr. Shatkin is here to talk about. And that's what we're going to be talking about later in the show. Is also, whatever that is, finding your bliss for Dr. Todd when he's here, it's for people who want to smile and be able to show that beautiful smile off, and they've never had that in their life. It can be as easy as that, and when you have the doctors here, believe me, they can tell you just how easy it can be when you finally get into the office.
Well, you know how important it is to me and to my staff. We're opening up another facility out in East Aurora.
This is exciting.
Very exciting. It's going to be opening up in June, probably the next couple of weeks. It's Aesthetic Associates Center. It's going to be our Medi Spa out there, right on Main Street. And if you live out in that area and you want to find out more about it, call my office, because we're bringing to that community and to the whole Western New York community a wellness type setting. We're going to have all sorts of skin management, nutrition, general wellness things, and trying to make people feel better about themselves, and that's what it's all about.
All right. Oh, that's going to be exciting. You have to tell us more about that when we get closer to the opening. It's going to open in June, though. All right, another phone call. I know somebody else is standing by. Hello.
This is Randy. Hello. How you doing?
Good, Randy.
I'm calling asking Dr. Shatkin. I have a thoracic disc herniation, and it's hard for me to work out. And I've developed a gut, which has given me low self-esteem, but also I was told it pulls on my spine. And I want to find out if liposuction can help my thoracic spine, and what are the criteria to have liposuction to help improve that problem. Okay.
You were talking about the tummy, the abdomen?
Yes.
Okay. All right. I didn't hear that at the beginning. Well, first of all, the liposuction procedures are somewhat non-invasive. They're small incisions, not a lot of cutting, so that makes it a little bit easier for you to recover. Strategically placed incisions can really work wonders as far as contouring and shaping and sculpting the tummy. I'd have to say, though, without knowing your general condition and your spine condition, it's hard for me to say that you're going to have some relief. But with proper nutrition and losing some of the weight on your own, and then whatever else needs to be done surgically with the liposuction, we can not only improve the contour, but probably improve the way you feel. So it's hard for me to say without really taking a look at you. Liposuction is a procedure that's not designed for weight reduction, but it is designed for sculpting and finishing off the process. So you can give our office a call, and because you called on the air, I'll give you a free consultation, and let me take a look and see what we can do to offer you.
And it sounds like that may be where he is, because it sounds like he's taking real good care of himself, but he's got an issue.
Yeah, if he's got an issue, we certainly can help with that, and that would be great.
That's a great
We'd be happy
question.
to see that. Yeah.
Yeah, and a lot of men do go to the Aesthetic Associates.
Right, we have a lot of men, absolutely, and more so men now than ever, because a lot of them are competing in the workplace. We know that with the economy the way it is, everybody wants to not only put their best foot forward, but also put their best face forward. And we can help them with that to make them look refreshed when they go to work. They can feel good about what they're doing and get the response from their coworkers that they need. And that can make a big difference, I think.
Well, as we said, later in the show, we're going to open the phones about how you find your bliss in this crazy world. But we know for those who are looking for Dr. Shatkin, this could be the phone number you're looking for, because there's no reason why you can't feel better about yourself and take any of these really wonderful new treatments and use them for yourself and achieve that look, if that's what it is that makes you happy. Hey, listen, they're located at 2500 Kensington Avenue, soon to be in East Aurora, but give them a call today about that consultation and find out about their products that will work for you. 839-1700, 839-1700, the Aesthetic Associates Center. And we're happy to say that this segment has been brought to you by the Aesthetic Associates Center.